There are so many reasons why massage would be a good modality in a treatment. I love them all. Massage is truly so useful and so versatile. A few main indications would include the breakdown of restrictions, the release of muscle tightness, the positive effects that massage has on pain, and of course, its circulatory benefits. One of the most important indications would be its beneficial role in touch and how our bodies react to touch. This is where physical treatments become just as important for the mind and the spirit as they are for the physical body itself. When we treat people, we are caring for them. We put our hands on them and we touch the areas where they're in pain. The hope is that we help make them feel better. This happens in their head and their heart just as much as it happens in their physical bodies. Now, of course, not everybody reacts so positively to touch. As therapists, we respect this, and it's important to meet people where they're at. Please take the time to read through these slides. Get to know the indications and contraindications well. Securing this stuff in your head will really allow you to turn this into common knowledge. Remember your physio training, you're working on the same body that I would work on. The guidelines for safety and for contraindications overlap quite a bit. Some obvious contraindications would include acute inflammation, like immediate post-surgical sites, or blunt force trauma areas that the tissue is way too sensitive to touch still. All that inflammation makes everything very delicate and fragile. We don't want to be pushing and pulling on fascia that is already having a hard time. It is likely to sustain injury just from the treatment we would attempt to do. We need to always be asking ourselves, how will these tissues react to what I'm doing? Will they be able to handle this treatment and still have the ability to support itself when the client goes home? So keep going down this list of CIs here. We get into deep vein thrombosis and other types of circulatory issues. Again, if increasing circulation puts the client at risk, then we really need to stop and think about what's best. In this list, you'll also find that suspected cancer is a contraindication. Now, this is not always the case. It's very common for cancer patients to need treatment. And this is where making sure your client's doctor knows that they're coming in for treatment is important. In class on the Saturday, we will be having Shirley do a presentation on massage and cancer, and I already know you guys are going to benefit greatly from what she has to say. Before we leave this contraindications section, which again, I really want you to take the time to read through, we need to remind ourselves to check the client's use of medications. Their general health is important, and the medications that they might be on could possibly change what you want to do with them. Maybe your client has osteoporosis. Maybe they have varicose veins. Maybe they have been newly diagnosed with heart disease and they're still in their first year of blood thinners and cholesterol drugs. People bruise so easily on these medications, so your treatment pressure will absolutely need to accommodate for this. Another situation involving medications might be that your client is transitioning from one medication to another. This alone seems to cause a lot of bodily aches and pains. These situations, again, are extra delicate. Recently, I had a client transitioning onto new medications for her bipolar condition. She came to me not feeling her best, both physically and mentally. Clearly, this was draining on her in many ways. Knowing that support was needed both on a physical level for her pain, but also considering how mentally she didn't have a lot of capacity to truly withstand a physical treatment, I opted to focus using gentler treatment techniques. This allowed her nervous system to stay more relaxed. I did not want to create any kind of flight or fight response. I wanted her body to find rest and recovery from the treatment. It's in these ways that considering the whole body is very important. Even if sometimes doing deep muscle work is fun, we're here ultimately to do what's best for the client. Now to differentiate between what we're calling an endangerment site and a contraindication. Generally, a contraindication should stop your treatment and give you a moment to consider the safety of what you're doing. An endangerment site is an area in the body that when we're treating, we really need to be on top of our game about. We really need to remember our anatomy training. we need to sort of see where all those nerves are, where are all those blood vessels, that kind of thing, okay? So easy examples would be the front and the side of the neck, maybe the popliteal fossa behind the knee. We often think of the underarm sort of going into our underarm area, but also that medial aspect of the arm. These are areas that commonly need treatment, and that's great, but you really got to know what you're touching, and you really got to know what you're not touching, okay? So often clients are kind of on edge when you start to work in these kinds of spaces in their bodies, okay? They are a little bit more delicate, they feel a little bit more delicate, okay? So it might be good practice if you start to explain exactly what you're doing and exactly what your hands are doing as you're engaging with their body. This not only puts them at ease, but it kind of covers your butt too, okay? So let's say you had a client and they're having a very strong reaction to your treatment, and now they've come back to you and they're pretty sore. I've heard clients say before, well, maybe that physio pressed on my nerve and now my neck feels worse. So as much as this totally sucks, it happens to the best of us, but if the client doesn't know exactly what you're touching, they might walk away from that feeling really unsure, and they very well could think that maybe you pressed on a nerve, okay? So what I've gotten into the habit of doing is, for example, let's say I'm like, hey Susan, here I am. I'm working on your suboccipital muscles. This is what's adding to your headache, and I'm working on this trigger point, blah, 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 okay? So I'm educating them on what's happening in their body. That way they know what I'm doing. They know the kind of muscle work I'm doing. They know that I'm doing trigger points. Everybody is in the up and up. Everything is very clear about what's happening and what the results could be, okay? So this brings us to a list of some of the most common positive and negative outcomes of a treatment. Depending on the treatment that you just delivered and the client receiving it, a variety of outcomes are possible. It is true that often we are creating pain for ultimately creating improvement. What I like to explain to clients is that I'm hurting you in a controlled way so that your body heals better. What that means is that treatments often involve breaking up restriction, doing muscle stripping, creating brain activity. We are more and more aware of what's happening on our body, and this can be very hard for clients to handle at times. Some people really do enjoy a thorough treatment, and that's great. They can feel really good right away, really fast. They're great at dealing with pain, and they very much trust that recovery process. Other clients might need more reassurance. Perhaps they're really new to getting treatments, or perhaps they have the type of body that is just a little bit more sensitive. All of that is okay. They're allowed to be exactly what they are and who they are. It is our job to prepare them for what to expect. Remind them, you might feel tired, you might feel sore, you might need to rest. Help them to notice what improvements are happening to their bodies too, okay? Sometimes prompting your client to go through a range of motion pattern, or having them note throughout the day how they feel concerning a certain issue. For example, let's say I'm working with Susan and her plantar fasciitis pain is especially bad every single morning. I might prompt her and say, hey Susan, how's that pain been first thing in the morning? Would you rate it as a 5? Would you rate it as a 3? Would you rate it as a 7 out of 10? You know, and let her tell you, and maybe keeping track of that is going to help her realize that in fact she is getting better. Okay, you guys, we're very close to starting these treatments. Before we do that, I want to take a minute to talk about barriers, treatment etiquette, and draping.